So with this particular patient having knee osteoarthritis, we're going to be focusing on electrical stimulation with pain control using the gate theory, where the A beta nerves are distracting in the sensation from the A delta and C fibers. We're going to have the indication of pain control. The contraindications include cancerous tissue, impaired cognition, impaired sensation, moist and open wounds, or malignant tissue. So we're going to go ahead and explain this to the patient. So Caitlin, with all the pain that you've been experiencing, we kind of want to use some electrical stimulation to kind of help get that pain under control a little bit. What we're going to do is put 2 stickers on either side of where the area hurts, and it's going to send an electrical stimulation through, and it should be something that you feel and is comfortable. We don't want it to be uncomfortable or too strong and intense, because the goal is just to distract your pain nerves from what they're feeling. Is that okay with you?
Yeah.
Perfect. So we'll go ahead and just check to make sure that it's all right that we do this. You don't have any pacemaker or any other heart regulating device, do you?
No.
And you don't have any cancer?
No.
Perfect. You don't have a moist wound. And then why don't you close your eyes and let me know if you feel this, so just I can check sensation. Yeah?
Yes.
Okay.
Sorry.
Perfect. So we'll go ahead and with the consent, we'll get it set up on the device. We're going to be using biphasic pulsed current, and we want it on continuous because our goal is not muscle contraction, our goal is just pain regulation. We would do 20 to 30 minutes, but with this video, we'll just do it for about 30 seconds. And the frequency rate needs to be higher because we're doing high rate 10, so it'll be up from 80 to 100. So we'll just keep it on 80 since it's our first time. And then the width, we don't want it to be high because we don't want to stimulate motor nerves. So we're gonna go to 100, and we'd usually have it from 50 to 100 with that. So then we'll have it on either side of her leg. There you go. And the intensity will just be as she feels comfortable with, because again, we're not doing low rate 10s, we want to focus on high rate 10s. So Caitlin, why don't you just let me know when you start to feel it and it feels good, okay?
Okay, right there.
Right there is where it feels good, or just
Yeah,
where you're starting to
that's
feel
where it feels
good? Okay, we'll just go ahead and keep it on for a little bit. Again, we would do 20 to 30 minutes in the clinic just to promote the pain relief, but while we're here for this video, we'll just do it for a few seconds. So how's that feeling, Caitlin?
Feels nice.
Feels nice? Good. No contraction, so that's great. We'll go ahead and stop it, and I'll take off the pads, and we'll check the skin to make sure there's no redness and decreased sensation, so everything feels normal?
Yep.
Perfect. And that's how we would do biphasic pulsed current for high rate 10s for pain control.